I now invite Dr. Dieter, DDG from ILRI, our beloved partner for this workshop, to lead the next session, which is very, very important, the livestock biosecurity and climate change. Dr. Dieter is a Deputy Director General of ILRI, and he has been leading many of these type of forums. We are glad that he is the opening batsman of this particular session. Thank you. Dr. Dieter, over to you.
Okay, thank you, Dr. Rao. So we have a little bit of problem with the people who are actually invited. And, for this session, the first session this afternoon, Dr. Djikeng Appolinaire, the Director of the Chair for Tropical Agriculture and Sustainable Development, and working together with ILRI in tropical livestock genetic and health from the University of Edinburgh. And it was before a member of our science team at ILRI is not available. So we have a little bit, and he should talk about the livestock genetics in relation to the environmental aspects. And I would like to give you some ideas and topics to set the scene what we want to do in this session here. And in the wake of the SARS-CoV-2 pandemic, much of the world has become aware of the importance of biosecurity in protecting the global health, and in particular the need for more effective management of the risk of introducing unwanted organisms at international borders. So there's always, the two things. There's an external biosecurity thing, and it's an internal one if you have the larger production sites in the developed world. You deal more with the internal than with the external biosecurity. But for Africa, certainly the external biosecurity is more important. Everybody, because of the pandemic, COVID-19, is talking about One Health as a tool to protect and prevent the next pandemic. We really need to discuss a little bit, is this realistic or is this just a dream? So we know that One Health is not a new concept. It has grown in its significance in recent years, emerging as a politically and scientific imperative for systemic and sustainable response to the complex and pressing global health threats linked to climate change, the declining biodiversity, the antimicrobial resistance, emerging and endemic diseases, infectious diseases, and non-communicable diseases. So there's a lot of this area where people believe that One Health is really giving us some solutions. Throughout the world, regional and national One Health institutes, political alliances, and academic and scientific networks have proliferated as well. And we have a lot of this heard yesterday when Jean-Philippe Dopp from OIE was attending. We had a video from the Chief Scientific Officer of WHO, and we had FAO involved yesterday. And this means investing in science partnerships across disciplines and capabilities so that we are able to prepare and prevent the next pandemic. We know around 1 billion smallholders farmers, many of them women, keep livestock for livelihood. The livelihood prospects are negatively impacted by animal diseases, by poor genetics, insufficient feeding, and now more and more on the impact of the climate change. Climate change can exacerbate disease in livestock, and some diseases are especially sensitive to climate change. Of about the 65 animal diseases identified as most important for the poor farmers, 85% are very climate sensitive. So there's very clearly the link between diseases, production, and the climate change. Climate change may also have indirect effects on animal diseases, and this may be greater than the direct effects. So if we want to define livestock biosecurity, then I think the best definition is to say any practice or system that prevents the spread of infectious agents from infected animals into a herd, region, or country in which the infection has not yet occurred. The important reason for high incidence of zoonotic and other infection diseases of animals are breach in biosecurity and livestock management, the closer contact between wildlife and humans, and rearing of livestock and poultry in close association with people. So biosecurity is important to improve or maintain animal health and reduce the risk of the introduction and spread of endemic and foreign diseases. And for sure, globalization has resulted in enhanced trade in livestock and livestock products, which accounts for nearly half of global agriculture economy. The enhanced trade has also resulted in increased risk of diseases to livestock and human beings. And I really like, a new term. We always talk about One Health. I think we should also talk about One Biosecurity. And there's a very nice overview paper by Philip Hulme from New Zealand, 2020, published on this One Biosecurity concept. And this concept is an interdisciplinary approach to biosecurity policy and research that builds on the interconnections between human, animal, plant, and environmental health to effectively prevent and mitigate the impacts of invasive alien species. It provides an integrated perspective to address the many biosecurity risks that transcend the traditional boundaries of health, agriculture, and the environment. One Biosecurity is essential to address several major sociological and environmental challenges to biosecurity, which is the climate change, increasing urbanization, agriculture intensification, human global mobility. Before the pandemic, there were more than 1 billion people flying to touristic locations, loss of technical capability, as well as public resistance to pesticides and vaccines, and in particular the anti-vax initiative movements and demonstration we see currently related to COVID-19 are an example for that. These challenges illustrate the need for the greater integration promoted by the One Biosecurity concept. Therefore, the major future challenges to biosecurity, such as I said, urbanization, climate change, agriculture intensification, and increased human mobility, all require the more holistic understanding provided by One Biosecurity to achieve a greater cross-fertilization of ideas and an improvement in approaches to deal with threats that impact multiple sectors. And we can really look at the vector-borne diseases and see how much the climate change is influencing all the aspects of health, productivity, livelihood of smallholder farmers, and so on. Climate can affect transmission dynamics and geographical spread, emergence and re-emergence of human and animal vector-borne diseases. A good example is the Rhipicephalus microplus, an invasive tick species of Asian origin and the main vector of Babesia species, is considered one of the most widespread ectoparasites of livestock. The tick has spread from its native habitats on translocated livestock to large parts of the tropical world, where it has replaced some of the local populations of Rhipicephalus decoloratus ticks. So these are examples for that. But there is also something positive in that, because these vectors, because of the climate change, these vectors are already established in the developed world. And the developed world is looking now to the south and hoping there's a solution coming from the south. And that leads to another, I think, very positive impact and maybe a financial support of all the research which needs to be done on One Health in the southern parts of this world, in particular in Africa here. So that's my introduction to this topic. And I think as next, I can hand over to Polly Ericksen from ILRI. And ILRI is the Sustainable Livestock System Program Leader of ILRI. And she will talk about climate change actions and adaptations. I think that's very important for this 2 days conference we have here. Over to you, Polly.
Okay, great, thanks. Hello, everyone. I'm sorry I'm not able to put my camera on, but it's a pleasure to be with all of you here today. I'm just gonna give you 2 very brief slides that I hope will hammer home the message that Dieter has already touched on, namely that climate change in conjunction with other drivers such as ag intensification and land use change is very much upon us and is going to create a serious layer of uncertainty and change to the disease surveillance programs and actions that many of you are engaged in. Hold on. So this is just a slide that talks about predicted changes in livestock suitability as predicted by mean annual temperature and mean annual precipitation. So this is from a paper by my colleague Philip Thornton and others. It's just come out very recently in Global Change Biology. And it's really, it has been a number of years until we've been able to have maps that showed these changes in suitability. So basically this is looking at changes in the number of days per year where you will see extreme stress values. And this is going out to the 2090s from the current day. If the area is in gray, there's no change. But yellow means 1 day, and this deep dark red that you see means you could have up to 365 days. So what this suggests is that areas that are currently suitable for cattle production, which is the example in this map, will no longer be suitable for cattle production because of heat stress. It also means that you may start to see adaptations, as Dieter was referring to, with people either moving their animals into wetter climates or switching species altogether. And I don't think I need to tell this esteemed audience what that could mean in terms of changes between human livestock and wildlife disease patterns. So if I go now to my next slide, this is a paper from Carlson et al. And what they have tried to do is look at the implications of climate change as well as land use change for what they refer to as these novel virus sharing events. And they define those novel virus sharing events as a potential overlap between species that currently are not overlapping. And they base this model on over 3,000 mammalian species. They used 4 different climate change scenarios and a couple of different land use change scenarios. And both of the examples I'm giving you are using results from the latest IPCC report. And again, you'll see the dark purple, the dark blue, there's a very increased chance of these novel virus sharing events in areas that coincide with human population centers. Because again, I don't think it'll be a surprise to you that human population and livestock populations tend to coincide quite significantly with one another. So I'm going to leave you there. I promised Ekta I wouldn't talk too much, but I hope that this is some data to shock you into thinking outside of the box a bit. Thanks very much for your attention. I really appreciate it.
Thank you, Polly. They're really shocking informations, and as you see, very updated one. And the consequences are, I think, clear for everybody here what it means. And I think as a reaction, we need to do something very quickly to, at least to slow down this process. We will not reverse it, but at least to slow down. Thank you very much, Polly, and it's great if you stay because we may have some other questions or discussion and comments on this as well. So I think Dr. Solomon Gebredufe has not joined yet, or?
No, I have not been able to raise him, so let's go ahead, unfortunately.
Yes.
Okay, so in the program, as you see, there's Michel Dione, and it's not Michael, it's Michel, because he comes from the Francophone part of Africa. And he is a scientist, a senior scientist at ILRI, and is a veterinarian, but has an MSc in environmental science and a PhD in medical science. And his research focuses on herd health and control of animal diseases in smallholder livestock system in sub-Saharan Africa. He was also doing research on testing improved delivery models for animal health services and inputs such as vaccines and drugs, as well as antimicrobial resistance associated with drug use in livestock using in a One Health approach, and is currently based in Senegal, but a couple of years now he was in Uganda, so he knows both sides of the African continent very well. Over to you, Michel.
Thank you, Data, and I'm sorry my video is stuck, but at least you can see my face. Hope you hear me very well.
Yes, we hear you very well.
Yeah, okay, so Polly mentioned climate change. I will paraphrase and say we also need stakeholder change of mind, change of behavior, change of the way we think, the way we prioritize, taking into account all these elements of climate change and related impact. So my thinking will be in 3 areas. What I think veterinary services would focus on, and what is the role of value chain actors, including farmers and other actors, traders, and all people and institutions working along the livestock value chain, and also around the policy making. Who are the policy makers and what do they think? I'll start with veterinary services. As Polly mentioned, the climate is changing. The disease trends are shifting. The behaviors of communities of people is changing. The population is increasing, land is decreasing. Animals are getting closer to people, and diseases are emerging and re-emerging. But often veterinary services, we focus on single species, single disease, during surveillance. And these are traditional diseases that we know that are mainly transboundary, such as PPR, CBPP, East Coast fever, FMD. And often the choice of these diseases is driven by maybe some economic drivers, because we want to sell our animals, like FMD, or we want to pass borders because we need those animals to get vaccinated. But veterinary services don't often tackle these emerging diseases because they lack of capacity to monitor, capacity to implement surveillance, because these are diseases that are very complex. They take into account the host, the environment, and also the practices. So there's need to involve another type of background or of experience, like modelers or behavioral change expert in the veterinary system, to be able to better understand the trend of these diseases and to put in place strategies to tackle these diseases. Another aspect is that often there's lack of data, or even there is no data to build on predictive models, to build on prioritization for vaccination or for implementing biosecurity. So we don't have data. And often if you have data, the data is not centralized, is not well managed. So these are issues around reliability of the data set. So these are issues we need to look into, because if you want to tackle these diseases, we need to understand them. We need to be projecting. We need to be having prioritizations because you don't have, most of these countries don't have enough resources. For the value chain actors, I think here I've done a lot of work around adoption of biosecurity of smallholder farmers in the pig system, in small ruminants. But we have always been able to increase the knowledge of farmers. Okay, they know, yeah, you want to tell them, house your pig or feed your pig this way, don't touch this. When there's an outbreak, you report, they know. But the application, the adoption has been very, very, very low. And there have been issues around capacities and incentive. And we have been trying to see what kind of incentive that can be put in place for these farmers and these valuation actors to apply biosecurity. And what we have also seen is often these valuations, they are not rewarding to these farmers. So farmers are the producers, but they are the ones who benefit less from the farm. So the other actors at the high level or the end benefit more during the trading and so and so. And these are issues really that need to be looked at to have a fair valuation that is rewarding to the farmer who can get more money and invest in improving its productivity. Around policy, what do we know or what policymakers know about emerging disease? How do they prioritize their action? Often, a lot of countries have been supported by organizations to develop prioritization of disease in the countries. And a lot of zoonotic disease come at top, but there's no strategy to implement the control of these prioritized diseases. So we don't really know what is the priority for countries, for policymakers. Is livestock a priority? And what do they put in place to protect animals and also people who live with animals and who benefit from animals to survive? So there is need really to understand all those things and also socioeconomic factors really that prevent from these policymakers to really directing their action into controlling emerging and re-emerging disease. Because of COVID now, we know that a lot of restructuring is happening, and this is an opportunity really to position ourselves and then to push biosecurity agenda all over the place right now. I think that is a great opportunity with the COVID. Thank you, everyone.
Thank you, Michel, for your information you're giving us from really working on the ground and working with the farmers, with the policymakers and decision makers. I think it's very helpful to hear from that. And I think I would like to ask you later on a little bit more about what are the priorities and the incentives you were mentioning, what are the most important ones. But now we go over and we have Wanda Markotter, a professor and the director of the Center for Viral Zoonosis, Department of Medical Virology, School of Medicine, Faculty of Health Science, University of Pretoria. And since January 2016, she is also occupying a DST NRF South African research chair. So I don't know what the abbreviation is, but you will explain us. In infectious diseases of animals and zoonosis. So really covering human medicine and animal health, and certainly, as I have read, you have quite some experience also with wildlife, which I think is a part which we had not covered enough during this 1.5 days already. So thank you for being able to present, and over to you.
Hey, thank you for this opportunity. I hope everybody can hear me clearly. So one of the other roles that I recently started playing also that I will also bring into the conversation is the co-chair of the One Health high-level expert panel that's advising the tripartite and Univ. And One Health is obviously a very important part of what this panel do, and some of the representatives may have alluded to this yesterday. So it's so great to have this discussion around biosecurity of livestock and climate change through a One Health lens, because it is absolutely essential that we follow these approaches going forward. And I just want to go back to a definition that was released by the 4 partner organizations at the end of last year that people may be aware of or may not be aware of. But it's a revised definition of One Health. And actually in this definition, we mentioned climate change also. So it was generated by the ILRI panel and then shared by the partner organizations. And we know One Health is not new, but it's really essential that we go back to some of these principles. And what we're basically saying is that it's a unified approach to really optimize the health of people, animals, and ecosystems. And we need to recognize that it's interlinked. What's very important is that there must be equality in these sectors. It's not just about the health of people, the health of animals, but the ecosystem and things like climate change should be just so important in this whole systems that we need to look at if we're really talking about pandemic prevention. A lot of times we talk about preparedness, but if we really want to get into preventing pandemics in the future, we really need to look at all these aspects collectively. And while we're looking at human, animal health and ecosystem health, we need to also tackle all the other things like clean water, clean energy, safe air, safe food, taking action on climate change, because we can't separate these things anymore. And I think if we talk about that, it's really important if we talk about livestock and climate change, that we really need to look at who's around the table when we discuss these issues. So that's the first thing. And it's also part of the One Health definition that ILRI released, that we really need to bring all the role players into the conversation. And that includes society. So there's really a strong focus on really listening to communities on local level and really understanding the situation on the ground and not just on a global level. And in my opinion, from some of the livestock work that I've been involved in, we sometimes have not good data on ground level. So we have a lot of data that we model based on global data. We don't really know what's going on ground level in a lot of countries or even on regional level. And I think the previous speaker also mentioned that we really need good data on ground level, and not just on diseases, not just on the health of animals, not just on how many animals, but really also on the environmental factors and the effect of climate change on the ground. And if we have this data, we can start looking at solutions together with the communities and other role players to really have meaningful solutions going forward and improve, for instance, in this case, biosecurity of livestock. I don't think that if we don't have this really hands-on approach on the ground, that we can make a sustainable difference in the type of solutions that we can propose going forward. And that's really becoming really important for all the sectors to work together. Sharing, first collecting of data, but then also sharing data so that we can actually use that to look at solutions. And as I said in the beginning, really looking at prevention and not just preparedness when something has happened. Really move into prevention of future pandemics and healthier lives, not just for humans, but also for animals and the ecosystem, and solving issues like climate change also in that process. So that's maybe just in short, a very general, some very general comments from my side, and I can also have a discussion with the audience if necessary. Thank you.
So thank you very much for this introduction. Yeah, sorry that I missed that you are co-chair of OLEP with my friend Thomas Mettenleiter. So, and we, as we said yesterday already, the definition was very helpful, and we actually we're happy to have this now, because there were too many different interpretations of I don't know if you hear me, because
I do hear you.
Yes.
Okay. So guide us in the future as well to many of the discussion which will come up, and therefore I was very happy to hear that. The other thing you mentioned was the data, and we had it yesterday already, the discussion on data, and particular Jean-Philippe Dopp from OIE was clarifying how important data are, and so we really saw this is an important part as well. I really like when you said we should not only look at preparedness, we need to look at prevention. And that brings me to one question which you already had once to answer so far I see. And this is, what is the wildlife biosurveillance? Can this prevent the future pandemics? Because you talked about the importance of prevention and not only preparedness. Can you say, because you work with bats and other animals, which are certainly most likely the start of many of the pandemics which were in the past and the one which will coming in future. So it would be nice if you could elaborate a little bit on that.
Yeah, so I think it's an important part of the puzzle. Wildlife the only part. It's not going to save us from the next pandemic. I think one of the things, and I think your next session actually deals with that, is how we look at socioeconomic factors. We really need to, and I see my internet is unstable now, so I hope everybody hears me, but we really need to look at human behavior factors and understand what's the reasons why people get into contact with wildlife. So just finding a virus in a forest is not going to mean it's going to spill over tomorrow. There's a lot of other factors, and livestock and other animals also play an important role in this spillover interface that we need to look at. So it's part of a picture, but it's not the only part of the picture, in my opinion. Right?
Okay, thank you. Michel, I had asked you before already, that I would like to hear a little bit more about the priorities and the incentives you mentioned. In particular, I'm interested, do you see, because this is an African session we have today, and you worked in East as West, do you see there's a difference in terms of incentives and prioritizations at the two parts of Africa?
Not really, because the system are most likely the same, only that in West Africa, erosion and the heat is more pronounced in the Sahel. And then there's a lot of movements of animals along the Sahel, which is the major difference between West and East Africa. So if it comes to the spread of the disease with animal movement, it's even more complex to understand here than that side. But when it comes to incentive, because of the type of the production system, smallholder farmers who have low input, low output, and often don't see the problem. Sometimes they lack of knowledge of those diseases they live with. So there's also a need to raise awareness, knowledge, and So I think there is something to do there around raising awareness, but the incentive per se, we have explored linking production to the market, because when you produce, most of the time, not always, the objective is to sell to get money, but not always, because we have seen in some systems, especially the pastoralist, they don't only produce to sell. Sometimes they produce because it's cultural. They need to produce, they need to keep the animals, so they need to keep the animals near them, sometimes in the same roof, it is a very old practice that they cannot really live like that, because just we are talking about zoonotic disease. They will tell you that we have been doing this for years and years. So there is really some socio-cultural embedded issues that really need to be unpacked. Yeah, thank you.
Yeah, thank you, Michel. I have a question to Polly. You know, what do you think is the weakest link in the animal-human environment continuum we must fix in the future? We talked about this enormous pressure we have because of climate change on the system and the change of the system. So what is the weakest link, or the other way around? What organizations or professional groups you believe are not working with us or with the One Health initiatives, but definitely need to be there and help us to be more effective and particularly be more faster than we actually are now? Polly, are you there? I think we lost her. Okay, because
I don't see her online, Dieter.
Okay, so because there was also a question in the chat for her, but there is also a question, and it was in the chat answered, but maybe we could discuss it here. And the question was from Ali Halachian from Elanco. It was on Professor Wanda, mentioned the data gaps. Perhaps shouldn't we start compiling an African One Health gap list? This will allow students, researchers to fill the gaps. Maybe quickly, yes, I could see this. Would you ask the question again? I see you are on with your video.
Yeah, thank you. The thing is that in all of the meetings that we have about One Health, we always talk about something is missing, you know, to have the cycle of a disease, for instance. You know, there are items that are missing, and if we don't have them, we can't prepare, you know, properly plan. So I was just thinking that perhaps we need to have a list of the gaps, you know, for different countries. You know, many of the African countries, we currently have a One Health kind of center currently. In some we don't, but in some of the countries we have. Maybe we can start compiling such a gap. And the thing is that the advantage is not only for the researchers of that certain country, but it's also for other countries. We might have a gap in South Africa that, for instance, the expert is in oil, you know, in Kenya. So if we show you the gap, then we can have a lot of kind of organizational collaborations. Thank you.
Okay, Wanda, could you answer?
Yeah, so I think it's really important that we look at what's ongoing and, you know, share that information. There's a few initiatives going on. I think ILRI actually also have under, I think it's the One Health Center in Africa. They also commissioned a review to look at initiatives in sub-Saharan Africa. So I don't know how far that data is. Some of it is shared. But a lot of times we don't know what people are doing because it's not shared. So it again go back to how we share information, how we make sure that we know what's going on so that we can fill the gaps and that we don't redo things in the same regions or do the same things in the same regions all over again. Because if we look at surveillance, for instance, it's very patchy if you actually go and look in Africa where people have looked at zoonotic diseases and included livestock in that picture. You know, so we're really on the ground not doing what we're supposed to. And I think a lot of times it's because we don't share the information and who's the experts that we can contact. So I agree with Ali. It's a very good idea. I think under the Elephant project that he's from, there's also plans to do that. And I think all these initiatives should be linked up and work together rather than work separately. And I think the world is changing. People want to collaborate. I think we are in a better space after COVID. And we can really go forward looking at these things together.
Okay, thank you. I just want to add, before we started our One Health Research and Education Center in Africa, funded by the German government, we took a look at what One Health initiatives exist in Africa. And we were surprised of this enormous high number of activities in Africa. And for sure, if this network would work together and would be willing and able to provide the data they have, we would have very quickly a very good idea what's going on in Africa. So I think that's a good suggestion here. I thank you all for this session and hand over back to Dr. Rao for leading us into the next part of the conference.
Dr. Kai, would you like to start or?
No, please go ahead, sir. That's fine.
Yeah, thank you, Dr. Dieter. I think this was one of the lively beginning of this second day. In fact, biosecurity and climate change very close to the heart of many people. Still, if we have to implement many programs, we have to fill the gaps and priorities. Yesterday also, we had a very heavy discussion on how to prioritize, where to prioritize is location specific, region specific and all.